Have you ever heard of a blood test that can detect cancer early, even before you feel a single symptom? Well, meet the PSA test, a small test being impacted, especially for men above 45. But what exactly is PSA? And should you get tested? Let's decode it simply, scientifically, with a smile. Hi everyone, welcome to Moho Health, your simple guide to health without a heavy burden. Today we are diving into the PSA blood test, what is it, how it is work, and whether it is right for you. If you are a man above 45 or have someone in your family, pause this video and tag them. This might literally save their life. So let's know what is PSA. PSA stands for Prostate Specific Antigen. It is protein made by your prostate gland or a small gland found in men, located below the bladder. If a little PSA in your blood is normal, but when it is high, it could be a sign of something going wrong, like infection, swelling, enlargement, or in some cases, prostate cancer. Why is PSA test important? Because early stage prostate cancer often has zero symptoms. You can feel completely fine, but inside something might be growing. PSA test acts like a smoke detector, alerting you before the fire spread. It is not perfect, but it is useful. What is normal PSA levels? For most men, PSA below 4 mg per ml is considered normal. Between 4 to 10, it is gray zone, need further testing. Above 10, high risk possibility of cancer. But age matters too. PSA levels slightly increase as men get older. So always check with your doctor, not just Google. Does high PSA always mean cancer? No. High PSA does not always mean cancer. It could also be due to prostatitis infection, BPH, enlarged prostate, even riding a bike before test. That's why doctors often repeat the test or suggest other scans too. High PSA mean cancer? Tell me, it is myth or fact? What is free PSA versus total PSA? Total PSA, all the PSA in your blood. Free PSA, the PSA that is not attached to protein. Ratio of free PSA to total PSA helps doctor to guess the risk, which is mean low free PSA means high the risk of cancer. High free PSA likely non-cancer causes. Think of it like detective work. PSA gives the clues, doctor follow the trail. Should I take this test? If you are a man over 50 or 45 with a family history, then yes, talk to your doctor about the PSA screening, especially if you are experiencing frequent urination, weak urine flow, painful urination, or blood in your urine or semen. The PSA test is not scary, it is just a simple blood test, but it can save lives. It does not give answers, it gives clues, and the earlier you find those clues, the better your chances. So don't fear the test, fear ignoring your health. Wanna a full video on free PSA versus total PSA or how to naturally lower PSA levels? Comment part 2, I will make it happen. Thanks for watching. If you found this video helpful, hit that like button, share it with someone who needs to hear this, and subscribe to Moho Health.